Welcome to another installment of our series called Debunking Myths of Mental Illness. Today's topic is therapy is only for crazy people. I am Dr. Wendy Rice. I am a licensed psychologist in Tampa, Florida. I run Rice Psychology Group. Rice Psychology Group is a group, so it's not just me. We have therapists here with a bunch of different types of expertise. So just wanted to add that. I haven't mentioned that before. Okay, so I'm filming this video during October of 2015, and it is Mental Health Awareness Month. And I want to talk a little bit about the stigma associated with going to therapy because I think it's really silly. Everybody needs somebody to talk to. Everybody needs a coach. Everybody needs like a ground person. And I think that's a lot of what therapy is. It is for people who are having serious problems, but it's also for people who would like to be living a better life or are experiencing some level of discomfort or feel like they're not coping well enough and they need a sounding board and they need somebody to look at their life with them in a non-judgmental, curious, unbiased way so that they can find some other ways to cope and manage. The idea that if you go to therapy, you are, really mentally ill, or you are crazy, or there's something horribly wrong with you, or that everybody who goes to therapy is having hallucinations or has schizophrenia is so not true. And I think it's way more a sign of strength than it is a sign of weakness. I have gone to therapy on and off for years. I think that every good therapist out there, hopefully, has been on both sides of the couch because it gives me a much greater understanding for what that's like. I am a horseback rider. I still, to this day, take lessons, and I have a coach because I need somebody on the ground to help me look at my position and to help me to make corrections, anticipate problems, help me manage when my horse isn't in a great mood or I'm feeling tired. And we don't live in a vacuum. We all live with either family members or coworkers or friends, and we have difficulties. And it's so nice to have a sounding board and somebody to talk to. So it's so not for crazy people. I really think that everybody could benefit from having a therapist who can support them. So I hope that this has debunked a little bit of the myth that therapy is only for crazy people. People come in and they say, I must be crazy because I'm in therapy. And I'll say, I'll let you know when I see crazy. And I see people with a lot of different problems. And I typically don't think that people are quote unquote crazy. Let me just backtrack for 1 second. When I was in graduate school, I worked at Bellevue Hospital, which is a very famous psychiatric hospital in New York City, and I worked on the adolescent inpatient unit. So those kids had some very, very severe mental illness that got them placed on a locked unit in a New York City hospital. And we would take them to the roof to play outside, and they call that the bird cage because it had a roof on it and it was fenced in, and the kids would go up there and they would make up dances and they would play basketball. And I was so struck by the fact that these kids who were pretty sick and had some really serious problems were also just kids, and they were doing things that kids do. So please, please, please see therapy as a tool and regard other people and yourself, if you're going, as doing something wonderful for yourself. So if you or a loved one are looking for therapy or need some support, reach out to a psychologist in your community. Give us a call. You can find us online at ricepsychology.com. Send us a confidential email at info@ricepsychology.com, and we'd be glad to help. Thanks so much for coming.